Welcome to the video podcast on the brain from knowing to doing. Today's topic is transforming your brain with psychedelic medicine. And I'm delighted to have with me today Dr. Phillip Romero, MD, retired assistant professor of psychiatry at New York Presbyterian Hospital, Well Medical School, College Cornell University. He's in private practice as a child family psychiatrist, but he's also an artist and an author of 5 books and a filmmaker. Phillip is renowned for recruiting the brain's innate creativity and the body's genetic resilience, and he developed creative intelligence training, CIT, and he integrates that with ancient mindfulness practices and the latest social neuroscience. But in 2022, the focus of this video podcast, he wrote a book called SOX, Rewiring Your Sense of Self. And he has done that through integrating his practice with psychedelic medicine, particularly ketamine. We'll come to that in a moment. And in the service of rewiring your sense of self, a really marvelous, prescient topic. Now, I'm in San Francisco, where this entire psychedelic revolution is on, Phillip, and he's trained over 40,000 hours of direct patient care and over 5,000 hours of training child psychiatrists. Wonderful to speak to you again, Phillip.
Great to be here, Evian. And I lived in San Francisco before medical school and was part of the underground comic scene, and Janis Joplin was a hometown girl, and I met her out there. So I'm very familiar with the psychedelic 60s and 70s of San Francisco. So it's great to reconnect with you and the city. So I want to approach this conversation by just revealing how I think. I've been thinking about this for 30 to 40 years. And midway in my neuroscience education, the term emerged EVO-DEVO, evolutionary development, which looks at development of the individual and then the evolution of culture. Now, that's what the art imperative is really about. It's an EVO-DEVO book about art and culture, brain, mind, art, culture. In my practice, which is based on recruiting creativity, the neuroscience of that has really made leaps in the last 10 to 15 years. The sense of self in each of us is a developmental process. Children have a very limited sense of self and limited ability to think. They can't really do abstract thinking until puberty. Girls are better at it than boys. And it takes the brain 25 years to develop. So it's a slow process of developing a sense of self. And I see a lot of young adults, and they have great college degrees, but they don't know who they are or what makes them happy. And they don't want to be a lawyer or a doctor or a banker. And they're very confused. And how much time do they spend creating a sense of self? Zero. They don't know how. They've never learned. So I have built this system, creative intelligence training, from this EVO-DEVO model, evolution of human culture, and the development of the individual sense of self. So to make it very pertinent to today's neuroscience, there are 2 aspects of the brain that inform the sense of self. The default mode network, which we'll talk about when we get to ketamine, is called the resting sense of self. It's a complex network that ultimately informs the narrative of me. We could call it the ego. And it's narcissism. It's all about mine and me and want and get and don't share and my turn and all this me. Look at me. I'm happy. I'm a success. I'm on vacation. It's not you at work. It's you relaxing. Meditation, which is quite old, 2,500 years ago, emerged, and it challenges the ego. It says, be still, do nothing, breathe. Watch your breathing, watch your body, be a body, not a me. And so over time and years of disciplined practice, meditation dials down the ego. It's like a rheostat on the me. And when you really are an accomplished meditator and you sit, maybe on a weekend retreat or something, you're gone. You're not talking to anybody. You eat, you sleep, you go to the dojo and you spend 8, 12 hours meditating and you're not there. And it is the most refreshing rebirth because the sense of self that emerges from a meditation retreat truly is new. And a lot of garbage has been dumped in those not me states for prolonged periods of time. Now, very recently, a new part of the brain has been identified, which is linked to the default mode network, and it's the anterior precuneus, which is sits right towards the back of the brain, and it is believed that this is the body self. Very interesting what happens when they stimulate the right and the left. When they stimulate one side, it feels like, I am falling, I'm falling, I'm falling. And when they stimulate the other side, it's like, oh, I'm floating, I'm floating. But it's the body. It's not me. It's the scientists call it, this is the I, the embodiment sense of existence. Whereas the me is my ego, my attachments, etc. So these two communicate with each other developmentally over time to create the sense of self, which is dynamic and ever changing, can be guided in its creative making, which is what I train people to do. And then if we look at, well, gee, I don't want to spend 25 years in the dojo, liberating myself from my greedy ego in this, materialistic world. Psychedelics, what do? Unplug the default mode network, but they don't unplug the precuneus, anterior precuneus. So the sense of I, pure consciousness, is all that's left. As you go into the ketamine experience, just about an hour, at about 20 minutes, as the hallucinations begin and you begin to have this distorted sort of sense of what's going on? Where am I? Am I alive? And finally you feel like, am I dead? And the I is no longer embodied and it's just perceiving. And then boom, the big hallucinations come and the childhood memories, and you get this flood of unconscious memories and hallucinatory projections, and it's a drift, it's a journey, and so you're not yourself for quite a period of time, and then as the infusion reduces, you gradually return. And when I'm with patients observing them, one of the first things they do is start, oh, my fingers, oh, my mouth. They start to come back like a baby, to their embodiment. And eventually the sense of self emerges. And those who are able to get to that full release, they all say the same thing. Wow, I'm not afraid of death, So it can be very therapeutic, we know, for, depression, PTSD, OCD. It has tremendous power to activate the neuroplasticity of the sense of self. And that's where the training that I do, the creative intelligence training, takes advantage of that window of plasticity and the experience of transcendence and puts it into a new narrative of self, an auto-poetic sense of self.
Beautiful. So let's just unpack a little bit of that beautiful distillation. So there are a couple of things that I love to focus on, and that is you've really heralded a new kind of approach to reformulating a sense of self through the use of drugs that have the incredible benefit of creating neuroplasticity, brain flexibility. And in previous podcasts and in the summary of the brain, we really emphasize, Philip, that you have two states. You can be in fight and flight, where you're not very flexible, very hard to change. You're very, very focused on survival, versus calm and flexible, vagus state flexibility. Now you can we'll come to other ways to get that flexibility at the end. But here's this dramatic way that in minutes, really an hour, you can create an intense state of brain flexibility. And we know that the beauty of therapy, all therapy, talk therapy in particular, but all, and we're coming to a particular form of talk therapy that you do in a moment, or a humanistic kind of therapy, but doesn't matter. We'll talk about a number of them. But it's hard to imagine that it works without this flexible state. So you're inducing the state. We just talk a little bit about ketamine? And it's only very recently that the FDA has allowed this to be legalized, and it's reimbursed. And it's one of a number of examples we'll maybe come to at the end. But just tell us a little bit about ketamine, the drug. And then let's talk to creative intelligence training. And then let's end off on your particular humanistic approach, which is fascinating, as an example of it doesn't matter what doorway you go in.
Well, the interesting thing about ketamine, it's been around for a very long time in pediatric anesthesiology, veterinary medicine, and used mainly as an anesthetic to a gentle anesthetic, which is why pediatricians, surgeons love it. And it was discovered some time ago to have benefits for PTSD and treatment-resistant depression. So they started researching it. The interesting story I saw was one group of scientists said, well, we're trying to create the therapeutic effects without the psychedelic effects. But when we take the psychedelic effects, it's not therapeutic. So, duh. What is therapeutic? Well, why is meditation therapeutic? Why is having a kind of out-of-body experience looking at art therapeutic? Or watching a sunset or looking at the stars? Why is it therapeutic? Because it overrides this default mode network, liberating me from me, and I become connected to everything else. Now, during the ketamine experience, this is where the psychedelic hallucinations are brain art. I mean, you see artists, I've got a few videos with music, and they got this beautiful AI-generated art. And I look at it and say, yeah, that's like a ketamine experience, but it doesn't unplug the me. So it's just a pretty picture. And that's my problem with psychedelic art. Unless you've taken psychedelics, which many people have not, the art is kind of abstract and pretty and, and so forth. But the real value from a humanistic point of view, we know is ancient. It goes back thousands of years, the use of psychedelic alkaloids and from peyote to mushrooms, etc. We know human beings have been playing with the me and getting rid of it and having ceremonies and sacred encounters with past and present and future beyond death as they live fully connected to nature. We have sort of jumped past that in our materialistic Western society, and it was rediscovered in the 60s by, our generation. Thank goodness. I took my first LSD 20 and wrote a paper on LSD and serotonin in my biochemistry class. So I was on the wagon. I said, okay, let's follow this. And then illegal for 30 years. So now that it's back, I've sort of come full circle and am using all the wonderful science that is now coming out about ketamine. And soon there will be other drugs, MDMA and LSD eventually will be used clinically. And studies are being done on that now.
Absolutely. And then the whole spectrum of possibilities for increasing brain flexibility. I mean, from brain training to basically stimulating the brain with electrical and magnetic fields, to ECT, of course, is the most sort of sledgehammer way. But all of these options are now part of the potential to really granularize what's working. What are the genetics for each person that may predispose them to a particularly good response from one of the ways, of that approach? And of course, the other thing that's marvelous about your ketamine focus is that it just shows that if you just focus in depth on one approach, it doesn't matter what doorway you come in. And we see this in applied integrative neuroscience all the time. It's part of the continuum. Everything is a continuum in the brain. For some people in the continuum, the doorway they come through is the brain doorway. Let's retrain the brain via specific targeted retraining, new habits. For other people who are more spiritual, which will come to your humanistic example in a moment, it's more let's connect to the bigger elements of the essence of the universe as a way to reshape our sense of self. And then now you have these brain activations, fire hoses of chemicals that'll basically rapidly create the state
Yes.
of flexibility. But you are one of the rare people that have combined doorway 2 and 3.
Yes.
Tell us about the humanistic convergence of the use of ketamine to create this flexibility, and then the approach, both in terms of creativity, intelligence training, but also your Buddhist philosophy into helping people find a new sense of self through that door.
Well, that's a fun story because it begins as a medical student interested in mindfulness training. I took a course with the Tibetan Lama in Houston. I was in med school in Galveston, and I got an introduction to go to Dharamsala and study Tibetan medicine for 3 months in my senior year. It was life transforming. And the thing that most struck me was the Buddha's Four Noble Truths. The first one is life is suffering, subjective. The second one is there is a cause for suffering, and it is the fear of the loss of attachment. So attachment is the cause of the suffering. And the third one is the solution to a fear of loss of attachment is to understand and accept that everything is impermanent and your point of view is relative. There's no single reality. And then the fourth truth is, here's the Eightfold Path. Do this and you'll suffer less and you'll accept life more. I read that and I said, Buddha was a doctor. This is the SOAP, subjective, objective assessment plan. I've been learning this in medical school. So I immediately started laying a foundation for my clinical practice on a philosophical and mindful practice. And I said, I'm going to teach all my patients about this, how to self-regulate stress, but more than that, how to recruit their imagination. So the sense of self, which is a story, an abstract story, is not a victim. So I created a system called Logosoma Brain Training in 1985 or something, word body integration training. I asked myself, what is a human being? It's a body that lives in a life story told by the body. When it's born, the story is told by the parents and culture and whatnot, but we're a body and a story, a logos and soma. So as I did that for many, many years, recruiting the creativity to make a new story, I divided the stories into two. The victim script, which you and I know is the HPA axis, hijacks the brain and generates cognitive structuring of self-pity, resentment, fear of losing control, numbing, self-sabotage, all that. The mindful brain, which requires training, is acceptance, gratitude, self-regulation, embracing impermanence, and so forth. And creativity is a critical part of that. So, this has been 40 years now that I've been training 40,000 patients with lobosoma brain training. And the recent development is creative intelligence training. When over the last 5 years, I realized I used to call it creative resilience training, but I said this is way more than resilience.
Beautiful example. And the beauty of it is that it applies, the learning, the model, the framework applies to any way of enhancing neuroplasticity and providing an intervention or a treatment across the spectrum. Talk therapies, brain training like CBT and DBT, brain body enhancement of a flexible calm state, meditation, brain music, medications, antidepressants, personalizing those with genetics tests like iSpot, brain stimulation like AlphaStim or RTMS for magnetic or electrical stimulation, and of course, all the psychedelics, as we've mentioned, beyond ketamine, the growing interest and potential use of psilocybin, MDMA, and LSD. But you have really helped elucidate some fundamental principles here, that depth and selecting and knowing about a particular type of brain plasticity, it is all about creating neuroplasticity, is the doorway, the real doorway for change. And then as we bring all of this together and personalize it, not just in what people should do, but what they feel is most matched for them, and what their genetics might help tell us is more likely to be matched for them, seems to me, Phillip, to be part of the future. And I'm very grateful for you sharing your story so magnanimously with us. Thank you.
Well, thank you for giving me the opportunity to remember, associate, and put it into a short, meaningful conversation with you, Evian. You're a master, and I am so glad to be doing these with you. So thank you very much.